Hi, this is group members Laura Bagley, Jamie Jensen, Alicia Jorgensen, Randy Hepworth Hansen, and Jessica Winder from Group 5, and we're presenting on obesity. An individual is considered obese if their BMI is 30 or higher. According to the CDC, over 1/3 of adults in the United States are considered obese. Not only does obesity greatly increase the risk for conditions such as heart disease, stroke, type 2 diabetes, and various cancers, but it is extremely costly for both the individuals as well as our country. For example, medical costs for obese people were more than $1,400 higher than healthy people with normal weight in a year. As a result of this growing problem, one of the top indicators for Healthy People 2020 focuses on nutrition and weight status of individuals. The overarching goal in this case is to promote health and to reduce chronic disease risk through the consumption of healthful diets, as well as the achievement and maintenance of healthy body weights. Both of these components of eating healthy and maintaining a healthy body weight are important in promoting and maintaining optimal individual health. Two of the objectives pertinent to our study are to reduce the proportion of both adults as well as adolescents and children who are considered obese. In order to move towards attaining these goals, healthcare workers help enforce different levels of prevention every day in the community and at work. Using primary prevention strategies, the goal is to help prevent obesity before it happens. This would include education on healthy lifestyle changes, good nutrition, and promoting physical activity to prevent obesity. Examples include classes on nutrition, exercise, and ways to stay active. Secondary prevention strategies include attempting to diagnose and treat an existing problem in its early stages before it results in significant morbidity. Examples include BMI screenings, blood pressure screenings, and assessing those who are at high risk. Tertiary prevention strategies include treatments to decrease the impact of the established disease by restoring function and reducing disease-related complications. Examples might include treating the problems associated with obesity, such as hypertension, diabetes, and hyperlipidemia. There are many factors to take into account when trying to understand why obesity is on the rise. Three influences that are playing into this public health crisis are behavioral, environmental, and socioeconomic issues. Healthy behavior among individuals in society is drastically changing. Individuals are consuming excess amounts of calories and acquiring a sedentary lifestyle. Because of the changes in behavior, people are not getting the proper amount of exercise needed. Environmental factors play a large role in obesity in the community. With more fast food and restaurant advertisements, people are eating out more and making meals from home less. The fast food industry has boomed, and with that, they have increased their portion sizes. The last factor, socioeconomic issues, plays a role because many families lack the adequate access to places for physical activity, whether it is a gym or even a playground. Many people also lack the knowledge of food nutrition, and some can't afford to eat healthier food options. In an assessment of the American adults, it has been found that 36.5% of adults are obese. In addition to adults, about 20% of school children are obese. This is becoming an epidemic, and action needs to be taken to prevent it from getting worse. One policy that has been implemented to help prevention of obesity is the Common Community Measures for Obesity Prevention Project. This project was created to recommend strategies and guidelines for obesity prevention. It includes strategies on physical activity, healthy eating, and safe communities for exercise. The assurance competency is met because of the introduction of nutrition guidelines for food service. This enables consumers to be informed on the foods they are eating and what is in them. Through the use of the three core competencies, we can start to decrease the obesity epidemic in America. Some of the long-term effects of obesity include high blood pressure, type 2 diabetes, which can lead to kidney, vision, and healing problems as well as other problems, heart disease problems including coronary artery disease, and increased risk for stroke, joint and skeletal problems due to increased weight to carry around, including osteoarthritis, disc herniation, spinal disorders, and back pain. Also due to increased weight in the neck area, Obesity can cause obstructive sleep apnea and other respiratory disorders, including increased risk for infection. With obesity, there are also increased risks for certain types of cancers, including cancers of the liver, kidney, pancreas, cervix, and several others. Lastly, obesity can have long-term psychosocial effects, including higher rates of suicide, depression, etc. Overall, obesity is a growing health issue, and there's a lot we can do in the public health arena to prevent it and decrease it. Here are references, and thanks for watching.